I may have discovered the medication that Donald Trump is getting through an IV on this hand where it always gets bruised about once a month. I'm a physical therapist with a doctorate in my field and 14 years experience treating patients that are geriatric, just like the president. There's a drug called Kisunla that was approved last July to treat Alzheimer's disease. It's a once a month IV infusion. But before someone can start treatment with it, a doctor must order magnetic resonance imaging or MRI of the brain if you have not had one recently. I believe over Labor Day, he definitely had imaging. He started treatment with Kisunla, and then 6 weeks later, he had another MRI to see if there was improvement or decline. Now, this drug works by preventing the buildup of what's known as amyloid beta plaques. The amyloid plaque buildup is characteristic of Alzheimer's disease and also the neurofibrillary tangles. These are like physical changes in the structure of the brain that correspond with a loss in cognitive ability. Notice it's used to treat adults with early symptomatic Alzheimer's, which includes mild cognitive impairment or mild dementia stage of disease. So this would make sense that Trump has been able to function well enough to maintain his office up to this point. Now we're starting to see symptoms arise because the disease is progressing. So he's getting a once a month treatment with Kisunla to slow the progression of the Alzheimer's or the amyloid plaques and neurofibrillary tangles to keep his symptoms at bay. That's why this bruising shows up roughly once a month. Now he could still be taking IV diuretics for heart and kidney issues, but the Kisunla angle really makes a lot of sense. As I've said before, this combined with all of his other health issues, I think he's got 5 to 7 months left with us. Thank you for your attention to this matter.